I'd like to bring in Congresswoman Diane Black, a Republican from Tennessee. Congressman, I'd like to get your take on this story. Good morning to you.
Good morning to you as well. Well, this is so disturbing that you have, once again, the president say he just found out about all of this. And we know that he visited the White House, so someone has a lack of memory there. But it is so insulting to the American people to say they're stupid and they wouldn't know about the true essence of this bill, when in fact the American people have never supported this. And even up until today, if you were to take a poll, you'd see that the American people still do not believe that this is the best thing for our country.
Right, but for some reason, the president was able to go around that and actually get this legislation passed. How?
Well, I think that's once again a question about why people didn't read the bill. Right. Nancy Pelosi said we have to pass this bill to know what's in it. I have actually read that entire piece of legislation, although I was not there when this was passed, and I of course would not have voted for it. But I think that's a question for those who voted for it. Did you really read the bill, and did you know what was in it? And now we're finding out that, and I've known this since I've gone to Congress, that when we take a look at CBO and as they give us the reports about the cost, especially as the changes took place, more than 50 changes have taken place just by executive order. They can't even score it anymore. It is that complicated. So this is a boondoggle. It needs to go. It is not helping the American people. At least there are some people, let's face it, that do get help by this, but generally co-opting 1/6 of our economy and having government control over our health care really is not best for the United States citizens.
Right, and you know, Jonathan Gruber's comments said it all. Basically, It was critical to pass it in the face of people not really understanding what was in it. And what did he say? He said it was call it the stupidity of the American voter, right? I mean, so that's clearly what was critical in terms of passage. Let me ask you about the op-ed that you wrote in the Journal recently that highlighted the continued security concerns with Healthcare.gov. What needs to be done there in terms of security?
Well, the fact that our federal government has spent over $1 billion of taxpayer money to build this, we have known from the very beginning that the security of people's most personal information has not been taken in full account. Just recently, as September, once again, we see that the Government Accountability Office has said there are over 20 security-related issues that they have found. We know that also there was a hacking of the website back in July. The government and they didn't find out about it until August, and there was malicious software that was placed in Healthcare.gov that would once again put people's most personal information at risk. And this is very, very concerning to me that it has been this way from the beginning. It continues to be this way, and people's most personal information is at risk. Now, here's the thing that we did in Congress to try to at least help if there were a breach in someone's information, is we passed a law with 67 Democrats joining us to say that if their personal information was breached, that the federal government would be required to let them know. Just let them know. And do you know it still sits on the desk over in the Senate on Harry Reid's desk? And they could take this up and pass this tomorrow because we still do not have assurances that the Healthcare.gov is secure and personal information will be protected.
So does anything change in terms of bills sitting on Harry Reid's desk now that the GOP is in control in the new Congress?
Well, I would encourage them right now to take it up because we're seeing all of this information come out again by the GAO, right, by the Inspector Generals. But if not, I see this as being one of the issues that we will take up after the first of the year to protect the American people and their personal information.
Congresswoman, thank you very much. Congresswoman Diane Black joining us. Meanwhile, more troubles this morning for the NFL.